Good day, ladies and gentlemen. I am Rudy, your host for today's webinar. Thank you for standing by and welcome to the Esri India webinar on Esri GIS tools, templates, and pre-resource for COVID-19. In today's webinar, we will learn more about Esri's ArcGIS Hub, coronavirus response template, workflows supported, and how agencies can configure it to engage, collaborate, and share near real detail time data with citizens and decision makers. The speakers for today's webinar is Mr. Ashish Dhawan. Ashish Dhawan is presently working as Divisional Manager, Pre-Sales at Esri India. Over 20 years, he has worked extensively in supporting customers in enterprise GIS implementations across various industries with a special focus on public safety domain. Currently, he is part of Esri India's COVID-19 task force, which is supporting customers across India in their COVID-19 response initiatives. For the duration of presentation, all participants' lines will be in listen-only mode. We also have a panel of Esri India experts on call to answer your queries you may have. We will have a Q&A session post the presentation. Meanwhile, if you have any questions, you may also send them across to all panelists using the chat window on the right side of your console. In view of COVID-19 lockdown, our teams are hosting this webinar from their home environments. We have planned this event to ensure minimal disruptions to the service during the events for your seamless experience. In case we face any unexpected disruption, please be patient and we would take necessary steps to restore the service immediately. So now, without any further delay, I would like to now hand over the proceedings to Mr. Ashish Dhawan from Esri India. Mr. Dhawan, welcome to the program. You are now ready to begin.
Thank you. Good morning, everyone. First of all, let me thank you all for taking out time and joining this conference, this webinar. So we will be today helping you to understand how Esri India is enabling the different government agencies to work for the COVID-19 initiative, especially for India. So we very well understand that COVID-19, the pandemic, is actually a biggest challenge for India, and it's happening at global scale. So it's not only India which is affected, it's almost, I would say, all the countries which are getting affected. And each country needs to plan as per their resources what is the best way they can support their government. So as we all understand, GIS is a platform. ESRI offers a ArcGIS platform which collects the data. Once it collects the data, you can use it for visualization, you can do analysis, you can do planning, and then all this data, once it's turned, it can also help you do decision making. So Esri India, the ArcGIS platform not only offers a platform to work for GIS, but it also helps to work for people from collecting the data to disseminating the data and do all their planning activities. So it's more of a framework, it's more of an enterprise platform which Esri India is offering. If we talk about the different government agencies which are now enabling the government to help during this pandemic, so we can understand that there are lots of health facilities which are there. There are lots of government hospitals which are there. There are lots of people who are working in the field day in, day out to work around this. So what is required here is that all the data which is coming from multiple departments, it has to be integrated into a single unified platform. The very most important thing which has to be kept in mind is that the data should be available in almost like a near real-time manner, so that whatever data is coming, we can do a proper planning around it. We also understand that since so many agencies are working like hospitals, so there are different kind of data which are available. Then we would also there are also places where we understand that there is demographic information which is available. We also understand that there are people who are vulnerable to this specific disease. So if we talk about the different kinds of data which is coming from different institutes and all the different government organizations who are working to ensure that they can stabilize the situation. All this data needs to be coming into a single platform. We need to do the planning, and once the planning is done, we should be able to take the right actions and do the corrective measures for that. So what is required in this? As I told you that there are lots of different information which is coming from different sources. So it's not only the data which is coming, it can be a simple data which is coming in a simple XLS file. It can be a data which is coming from population or demographics or census data. People who are nowadays, we very well understand that since this pandemic, we need to maintain social distancing. So if there are people who are coming closer to each other, it means that we need to even track them to ensure that they are maintaining the social distancing properly. So the data has to be tracked even from the cell phones as well. Then there are multiple hospitals where the different activities are going on. So the data is coming from multiple hospitals. Then there are multiple testing sites which are available. And then there are also models which are available which can actually help you predict how this pandemic is going to go ahead and what are the actual solutions which should be implemented to ensure that we can minimize the destruction. So what are the tools which Esri, as we told you that Esri India is offering you a platform. So it's through this platform, it's not only making sure that the people who are sitting in their offices can work, but then you can also, the data which is coming live, it can be updated on your dashboards. It can be viewed on your desktops. You can do analytics on top of that. There's lots of information which is coming from different sources. It can be created in form of charts, pie charts, bar charts, which can help you plan your things. We also understand that there are lots of people who are there in the field, and we need to understand that we need to provide the right kind of people at the right kinds of places. So which is called as resource allocation. So even Esri India platforms help you do this resource allocation. It helps you do the site selection depending upon any particular thing which we are interested in. We can run models to ensure that we work on a particular situation at a particular cost, and then we can do analysis on top of that. And if there are people in the field who would like to go ahead and do different kind of surveys, then Esri India also offers a mobile platform which enables you to create those survey forms, and then that data can be uploaded directly into the central systems. The best part about Esri India is that this platform is offering you to ensure that the go-to-market is much more faster. So the applications which will be created on using this platform, you can actually go to the market very fast. Why do we say that? Is because we don't need to actually enter into doing the development. It's just that by simple configuration, you can create all these multiple tools, whether you are working in offices or whether you want to have a common operative picture, having the situational awareness using dashboards, you would like to do your planning, or whether you are in a field. All these applications can simply be configured and they can be used the way you want to do. And it's more of a configuration. We have been working with multiple government departments to ensure that we can go to the market very fast. Now, coming to what Esri India is offering, we very well know that Esri is offering, globally, it's offering multiple resources to multiple users in multiple countries. But Esri India has taken this initiative to go ahead in India to ensure that you can work using the Esri platform, you can work for this pandemic, and you can provide the right information to the right people. Since we very well understand that the way the pandemic is behaving in different countries, it's different. So we need to plan, we need to do the activities as per that particular location. So each area is very unique, and we need to have different strategies for different areas, because the kind of people, the kind of resources, the kind of strategies which need to be implemented have to be planned as per that particular location. So what Esri India is offering, we need to understand that. So the very first thing what we give is you can very well find a URL which is down below. That's https://www.esi.in en-in programs disaster response corona impact 2020 overview. So people can directly go into this link. Once they will go into this link, what will happen is they will have the option to register themselves with Esri India, and Esri India will be helping them offer a platform. So once you go down to that place, you will see that there is an option which gives you request assistance. When you click on that, it will be asking you details of your organization. It will be asking you what kind of assistance you will be looking for, and it will once that mail has been submitted, once this form has been submitted, that request comes to ESI India, and we will be assisting you with the IT platform. We will be assisting you with how to enable this platform. How we will also be assisting you with the technical resources to ensure that you can provide the information which your organizations are getting. Different organizations must be getting different kind of data. So all that data can be taken up and it can be disseminated based on the data which is coming. Esri India also offers a hub, which is GeoNet Hub. Here we have all the different resources which might be required during this pandemic. So if there are multiple questions, if you want to browse through different contents, if you would like to see, you would like to have any special questions, you want to ask that. If you want to go to different contents, so Esri India is also offering you a platform where if you go to this page, you will be having the place where you can get all the information related to COVID-19 at a single place. So it's more of a single place to get all the information which is required during this pandemic. Esri India, as I told you, that Esri is working globally. So Esri is working globally with Johns Hopkins University, where it has enabled them to capture all the data. I would say it's now, since it's more than a month where they are working. So these dashboards were created in just few days, and people are using this dashboard day in and day out to see how the pandemic is going across in different countries. Esri has also worked with WHO, so it has helped enable WHO with the dashboards. And apart from Esri, as I told you that we are working very closely with Indian government, so we have worked very closely with NDMA to ensure that whatever data they are getting, we need to provide that information to the Indian customers, to the Indian people, so that they can have a live, almost like a near real-time information for their people. During my presentation, I will also be walking you through these dashboards so you can actually see what are the benefits which you are going to get. So to understand this, what is required? The very first thing what is required to start up with this is we need to get the data. Now, if you would have gone through the news, you would have seen that the government is ensuring that during this pandemic, no organization is allowed to share the data which is not authentic. So the very first thing which even Esri India is ensuring is it's trying to work very closely with different government organizations to ensure that whatever data is coming is authentic. And once we understand that yes, the data is authentic, we are enabling the different government organizations to create different dashboards, different web applications, different mobile applications, which can be shared to different people based on their requirements and based on their roles, the way they want to work. So what are the steps which will be required to do that? So we have divided it into a 5-step process. The very first step is mapping the cases to understand what are the total number of cases which are coming for this pandemic from different locations. So if we talk about India, it can be a state level data, but when we go to a state level data, we very well understand that we need to go to the district level to have more information about it. The second thing which we would like to understand is that how the disease is spreading in a particular location. So that's step 2. It it is also dependent upon that particular region. So we would like to understand how the disease is spreading. So step 3 is the vulnerable population. What do we mean by vulnerable population is we very well understand that there are people who if are already suffering from some other disease like that itch, they are more vulnerable to it. There are specific age groups like children who have got less immunity. Even they are the most vulnerable population. So we need to take steps for that particular locality based on that particular region. Once we understand that, the next thing what is required is what is your capacity. We would like to understand that if there are hospitals, if there are different resources which are there in the field, how many resources are there? How many hospitals are there to ensure that if the number of patients increase, whether we will be able to maintain, we will be able to take care of them or not, whether we have the right number of ventilators with us or not. So all this information is very, very important, and as the disease is spreading, we need to understand our capacity and to ensure that if the patients are increasing rapidly, then we need to plan and ensure that each and every patient who is coming with this disease can be cured. And the last step is to provide the right information to the right kind of people. So as I told you, as I was telling you that Esri India offers a platform. So using this platform, you have got different user management. In that user management, you can define which kind of people, what role they are working for, and what is the information which will be relevant for them. So based on the information, based on the resources, the right information needs to be passed to the right person. And for that, it's not a single application. You can have multiple applications using a single platform, which can be used, can be shared with different people. Now let us have a deep dive into each and every process, how it's working. So the first thing is we would like to understand what are the total number of cases. For that, as I told you, that Esri India is ensuring that whatever data sets are coming, they have to be accurate, the information has to be accurate so that the planning activities can be very much accurate. For this, we have been very closely working with organizations like NDMA, which is at a national level. And for state levels, we are also working with SDMA, state disaster management agencies, which have the right kind of data sets, which can be shared, we also get to know the information of different how the disease is spreading. So here what we have done is you can see a dashboard which we are showing you. You can have a national level view of how the disease is spreading in different states, and if you are interested to go to a particular state, you can go to a particular state and you can work on that. Second thing, what we would like to understand is, as I told you, we would like to understand how the disease is spreading. What is the total kind of spread? And we are talking about flattening the curve. So what is required to understand is which are the places where the maximum number of patients are being reported on daily basis, and what are the steps which can be taken to ensure that we can flatten the curve. So we need to understand each and every location and what are the real causes for mapping, for increasing, what are the causes for which the number of patients are increasing at a particular place. As I told you that we are offering a platform, so that platform also offers a place which is giving you a time slider. Based on the time slider, you can very well understand how the disease is increasing on daily basis and what is the total number of increase, what are the total number of active cases which are increasing, what are the total number of deaths which are taking, and how many people are getting recovered. So based on the time series data which is being collected on daily basis and which is being stored in a central platform, we can actually map the spread, how the spread is happening. The third thing which is very important for us to understand is which are the people who are more vulnerable to it. We very well understand, and as per the data which has been pouring in from different countries, from different places, we understand that there are older people with 65 plus years or senior community who are more vulnerable to it. So then there are people who have less immunity, like people who are suffering from cancer, HIV, dialysis, or diabetes, they are also more immune to this disease. Then there are people who don't have homes, they are homeless, and because of that, again it becomes a more place where they become vulnerable. Then places, since we need to flatten the curve, we very well understand that we need to maintain social distancing, but there are places where the density of population is so high, like we would have seen that in Dharavi, which is a place in Mumbai, and a very small area, there are hundreds of people who are very, very close to each other. So those are the places which are actually very, very vulnerable because of their high density population. We have got data which is available as per the census data. We can very well, by just putting that data onto your platform, you get to know which are those densely populated areas, which are those places which are having more number of people who are suffering from diseases. So based on the different criteria which are mentioned here, we can actually not only see how the disease is spreading, but we can also attach the disease spread with the vulnerable population. And based on the location, based on the vulnerable population, we need to ensure that these are the places where the maximum chances of disease spread is more. So we need to take much bigger actions at these places. So this information is really, really required. So based on, you can very well see on the chart, this is an example which we are showing on a chart, which can actually show you that which are the places which are more vulnerable. The bigger the circle, the darker the circle, the redder the circle, it means these are the places which are more vulnerable. And based on the size of the circle, we can very well plan that these are the localities, these are the hotspots where the government needs to take more and more action. The next thing is what we would require is that we know that since there are lots of agencies who are working around to help and cure people, so there are hospitals. It's not only the government hospitals, there are private hospitals who are working with this, and there is data which is coming from different hospitals. It also has information related to what are the blood banks which are available, how many ICU beds are there, whether we have the ventilators in place or not, whether we have the oxygen, right amount of oxygen cylinders which are available or not, whether the medicines are there or not. So these are the different data sets which are coming from different agencies into a single platform. And to maintain this, we really need to understand that whether we have the platform where we can actually use this data and give the right information to the right person. Because when the people are there, they really need to have the information that whether the hospitals will be able to take care of more new number of patients or not. The next thing which is important here is that the people, this application is not only, as I told you, it's not only for the people who are there in offices, but there are people who are there in the field. So people, they can also work in offline or an online scenario where they can use our mobile applications, create a form and update that information so that data gets updated and gets submitted to a central location so that information can be used by the people who will be requiring that information. So this is an example where we are showing that what is the total number of rates, how it is getting infected, whether the hospitals have the right number of beds available or not, ICUs are full or not, and how the rate is increasing. So it's actually enabling you to understand the capacity of that particular location, of that particular district. So based on the different districts, we can do different kind of planning, which will be required. And then the last thing is that once we have all that information, do we have the right kind of resources which can help you give the right kind of information to the right people? So for that, you just don't need a single application. It has to be multiple applications. So ArcGIS offers a platform which gives you a scenario where you can actually create multiple web maps. You can create dashboards, which are your single common operative picture, which gives you details of how the disease is spreading. Whatever numbers you want to see, you will be able to have that information. You can use story maps. So story maps are the templates which are there. You don't need to actually write a single line of code. Those templates can just be downloaded. You just need to push the authoritative data apps into these templates so that you can use it for your own purpose, and they can be used by the people who would be requiring this kind of information. So apart from as we already told you, that it's not only that people who are sitting in offices, that there are applications like collector app, survey 123 app, quick capture app. These are simple to download, which can be downloaded from the Play Store. You can just define what kind of data you need to capture. So if I need to take 10 attributes or 20 attributes and I want to tag it to a particular location, I want to take a photograph or I want to take a video and I want to upload it. So all that information, the videos, the photographs which are getting uploaded, they will get geotagged automatically. You will get to know that that photograph or that video is from which location, and based on the attributes which the organization needs to capture, you can define your own attributes into a simple XLS form, where you can say that I want 10 attributes. You can define it in an XLS and upload it. Once the XLS is uploaded, the app is ready to be used. So it's that simple. That's why we say that we have the predefined template which can be directly used, directly configured in few days, and the applications are ready to be used for your planning activity, for your management people to ensure that they can work more effectively. And right now we are seeing that as the days are progressing, there are new things which will be required to be monitored. The government is planning that they should open few offices. They should be opening few institutes based on their needs. So for that, we would also like that whichever people are going in the field, whether we should be able to track those people or not. Here, a very important thing which comes into important question which comes into our mind is that earlier what used to happen was that the GIS used to help or track people who were just having the information from a GPS device. If the mobile location is, you can track it. But nowadays, sometimes people knowingly or unknowingly, they might switch off GPS locations, but still we can still track them. Then there are options where the government has the mandate where they can take the CDR data, which is a tower information data, which can help you define that whether how the person is traveling and where he is going. You can not only track him through GPS, but also tracking through the CDR logs which comes. So there are multiple options, but then do you have the right platform to ingest that kind of data? And with Esri India, you have the right kind of platform where all these different feeds coming from different places, whether it's your mobile feed or GPS feed or your CDR feed or CCTV camera feed, all this can be integrated into a single place which can be used for doing your planning activities. The next important thing is that since during this pandemic, we very well understand that different locations are behaving differently, and we need to do our planning in a way to ensure that we are able to flatten the curve so that the disease is not spreading more. So for that, there are lots of 1,000+ analytical tools which are there in ESRI platform, which can be used. You can create your own models which can help you do your planning activities. Another important aspect which has come into this is a child model, which is there. It is a modeling technique which actually helps based on, it takes the different feeds based on the total number of hospitals available, based on the total number of cases which are going in a locality who are active, how many active users are there who are having this COVID-19, how many people are getting cured, how many ICU beds are there. So all this information can be put in a model. It can be model, and once that data is uploaded, we can plan that whether going ahead in next 15 days, next 20 days, the number of patients will be increasing, and if the number of patients are increasing, do we have the capacity to cure those patients or not? All this can be done using the predictive models, the child models from ESRI. The very, very important information here is that we need to have a historic information here to predict this. If we have the right kind of information, it can be put, and these models can be used directly. We can also understand that plan the different patterns, that once the offices start opening, what are the patterns, how the spread is going on, increasing or decreasing, and based on the patterns, we can ensure that what are the things which the government should take into mind before planning, that how the people should be going, which offices should be open. So all that pattern detection can also be done. Your resource allocation based on the kind of resources you have in a particular location, you can plan your resources, which can be sent to different places, and doing your site planning activity, site selection. So all these are different spatial models which are available in ESRI, which can be used directly. These are available as models. You just need to put in the right information to get the right kind of results and do your planning activity. So after talking about this, what the next question which will come into mind is that how is Esri India actually enabling you? Whether you have the IT infrastructure available to implement this kind of a solution. So I would say that Esri India is offering you a cloud platform where you don't need to bother about that, whether you have the servers available with you or not, whether you have the people who would need to configure this application or not, whether you have those people or not. So Esri India is offering you a IT infrastructure on cloud for 6 months for government institutes to ensure that they can use our cloud platform and they can create those web applications, they can configure them, and that data can be put on for use as per their need. What all different solutions can be planned? So you can definitely monitor the cases, you can track the people, how they are moving, whether there are, once the offices start opening, whether there are still public gatherings which are going to happen or not. Again, those public gatherings and these informations can very well be taken out from the mobile devices which the people will be using once they go out of their house by the tracking mechanism. So all these information can be used, and then as I already told you that there are then hospital information, the ICU bed information, which can again, all these information can also be put into your systems for your planning activity. Then we have got applications, the apps which are again easy to configure. The templates are available where you can plan when to open the schools, where are your medical facilities which are there, which are the places where the testing sites are available near you. So if you want to go, if there is a new testing site which has been added by the government or by the private hospital, by using the mobile app, you can directly update it into the system, and once the end users try to find that which are the nearest testing sites available for me, he gets to have that information. So that's the kind of near real-time information which can be derived from different templates and can be used by different kind of people, can be used by communities for using it. So all these templates are available in the hub. You can download these templates. These apps are available on the Play Store. You can directly go to the Esri India Hub site where you can download these apps. You can start working on them, and you can And once we give you the platform, we are also giving you a platform which is called as a ArcGIS online platform, which is available on cloud, where the users can directly log in to their organization and they can start working with it. And another very important question which might be coming into your mind is that if everything is available on the cloud, it might be public. So it's not like that. If an organization wants that the information should be available only to their own department, so you will be having your own users, you will be defining your own users, where you can define which user to give what kind of rights, and out of 10 applications which you have created, you can have 5 applications or 6 applications which are in-house applications which only your departmental users will be using, and you can have 3 to 4 applications for the public to share the information. So again, it's not that the data is not secured, it is 100% secured in the platform which we are offering you. And what are the different kind of solutions which you can see? So you can very well see that there are dashboards which are available, there are medical facilities which are available, there are if you want to have a case reporting mechanism using a Survey 123 app, they can be using it, and then the different people who can use it. There are GIS professionals who really understand the GIS well, they can use this system. And if there are people who are not much aware of GIS, but they still would like to use this information for their purpose, so who are there in the field, so they don't need to be a IT or a GIS savvy. They can be simple users, like they can easily work on apps like WhatsApp or that. So I would say the apps which are provided by Esri India are also easy to use, easy to configure. If you are an IT savvy, you can very well use those apps, and then this information can definitely be used by general public. Now, going to this, I would also like to give you some examples of what we have done globally and what we are offering you here. So as I told you that if you go, you see the site from Esri India, you can see that there is a disaster response option which has been provided by Esri India. The option where request. Once you click on this, you will see you will be going to a form where it says you want to request for these licenses, you want to request for some resources. Once you click on that, it will ask you a few questions related to your organization, what you want, what are the kind of, from which organization you are. Once you fill this form comes to us. We will be, our tech support people, our people will be, Esri India people will be getting in touch with you, and they will be taking all the information with you, and they will be assisting you to get addition. Another site which I was talking about was the Esri India GeoNet site, where it's a GeoHub Hub which gives you a single place where different contents related to COVID-19 are available. You can have all that information here. You can have the information related to apps. You can have all the information related to software, whatever is required, and how you can configure this. All that information you can have it through a single place where you can have this information. Now, I was talking about that we have enabled, with the help of Johns Hopkins University, we have tried to show you that how the disease is spreading. So this was a site which was prepared. It's now more than, I would say more than a month since it has been implemented. You can very well say that the data is getting updated on regular basis for each and every country. How many total number of people? So there are 24 lakh people who are already confirmed cases. The best part about this kind of a dashboard is you get to know what are the total number of active cases, what are the total number of incident rates, what is the hospitalization rate which is there. So all that information is getting updated on regular basis. You can click on any one particular country and the data related to that country gets updated on the map. And also you can very well see what are the total number of cases which are increasing on daily basis. So when you click on US, you will be seeing that yesterday there were around 25,000, 26,000 plus people who got infected. If you talk about Italy, you will see that the data is getting updated, the total number of deaths which are happened, what are the total. You would have seen that earlier in Italy, the total number of daily cases was around 6,000 to 7,000, which has been quite lowered down to around 3,000 since yesterday. So all this information is getting updated on regular basis, on daily basis. So this was for the global stuff. As I told you that we are working very closely with Indian government as well. So the first site which we created with the help of NDMA was so this we had created a dashboard for them where we had helped them to ensure that whatever the data is coming from Ministry of Health, the total number of confirmed cases, total number of all that gets updated on regular basis. You get to know when the data got updated. You get to know it region-wise. So we can very well know that the total number of cases in Maharashtra are the maximum, followed by Delhi, Gujarat, and Rajasthan. So again, the more information we get, the more better dashboards we can create out of that. So apart from the national level programs, we have also been working very closely with the state level programs. So there is an example where we are working very closely with PHE Department Maharashtra, which gives number of details of how many total number of cases are here. Here you can see the bigger the number of circle tells you that the more number of cases are coming from near to Thane or Pune, and the least number of cases are coming from Latur. So depending upon how the data is coming, we can very well go on updating that information. So again, the data which was shared by PHE, that we had created the dashboard for them. This is a public dashboard which is shared with public. Apart from that, we had created an application for Punjab. In Punjab, you can also see again what are the total number of confirmed cases, active cases, recovered cases, death cases. We have a full hotspot details of which is the place where near Mohali, which is having the maximum number of cases which are being reported from Mohali, which is being followed by Jalandhar. And what you find in this site is you are also getting a district-wise information here. You get to have the information for total number of confirmed cases, how many people are there which are home quarantined. So in home quarantine, you can see there are 6,000 people in Jalandhar, followed by Patiala, which is 4,000. Then how many hospitalized cases are there? How many people have recovered? All this information is district-wise, and all this information is being provided by PRSC, which is giving us this data. So based on that, we are also have the information related to isolation beds, total number of ventilators available and how many are being used, total number of ICU beds. So you can see that why we are showing you different options, different dashboards here is that the dashboard is the same. The feature is the same. It's just that based on the data sets which are available, you can design your dashboard the way you want. You can pass the information the way you want. It's a simple configuration. You have multiple widgets. Using those multiple widgets, you just need to define what kind of data you want to show to what kind of people. And another important thing which is I was talking about the demographic data. So once you have the demographic data, you can very well put that data behind this, and you can get to know the vulnerable population for that particular location, and you can plan your activities. So depending upon the requirement, depending upon your needs, you can very well share those needs with us, and we will be helping you create those applications. And again, I would say that all the apps, all the resources which Esri India is providing, they are very, very easy to configure. The dashboards which we have created, they have been created in just, I would say, in a span of 3 to 4 days. So it's just we need the information, and once we have the information, you share the information with us. We will be assisting you to help you create these dashboards, and then you can use it for your organization, or for if you want to share the information with public, you can very well do that. So this was a solution which we are offering, that we have the software, we have the support which we will be giving. You will get access to the ArcGIS India Hub, which can be used, and then the people from Esri India will be enabling you. They will be giving you the technical assistance to go ahead. You will have the options to create dashboards like we have created. There are many more dashboards which we have created for many more sites. I've just shared few of them, but then we are working with many other state departments. I would say there are 30 plus. There are around 20 plus states where we have implemented it, and we are working very closely with it. So these are the URLs which will be shared with you, which can be used. And then the last thing which we would like to talk about is the Living Atlas, the place where the lots of free data, lots of free base maps are available. You can very well use these base maps into your application as a background data, and you can do your analysis on top of that. So with this, I have come to the end of my presentation.